Good morning, viewers. The names were Gisha Ronald, the Hospital Director of Administration, Benedictine Eye Hospital. Benedictine Eye Hospital is a private, not-for-profit health facility located in Tororo. This facility is founded by the Benedictine Fathers in Tororo. They have a monastery there, and they oversee the governance and the management of the hospital. Today is our final day for screening. The hospital provides a variety of services. We provide the inclusive eye health, community-based inclusive development, and we also provide general services to stabilize patients. For example, if a patient comes with malaria, pressure, we usually stabilize them before we take them for eye treatment. Why inclusive? Benedictine Eye Hospital ensures that it is inclusive. By age, we treat right from 0 age up to 28 days. We also treat those ones, the children from 1 year to 18 years. Then above that, we have no limits. That's why we are inclusive. We also treat the disabled people, both the mental, physical. We also deal with that, and also why inclusive, we also ensure that we include all the people in different areas so that they are not excluded. That's why you see the other time on Wednesday we were in Busia, Mawere East Primary School. Yesterday we were in Lumino, Center 2, also helping the community there, screening them and treating them of the eye conditions, also doing the work of the community-based rehabilitation at the disability area. Today we are here at Tiira, the major mining area in Busia district. We are also doing our final screening in this area. We are so grateful to our different partners, of which if we did not extend the support, we could not be able to provide such services to the community. We appreciate the services of the CBM. This is the Christian Brian Mission. It's a German international NGO who have got us support for this drive, and we are which has made this function active. I'm sorry for this. We have to give services to the community, and there was some interruption, but I'm able to solve that. I was saying that we appreciate our partners, the CBM, for extending this support. CBM is the German international NGO. Through it is the German Development Corporation, BMZ government of Germany has also channeled their money through them. That's when we are able to do this activity for so further need for the last 2 years, and we are concluding this year in December 31st. That's when we are closing this community outreach, and this project is to build the capacity of the ophthalmologists in the Eastern region, and also the facilities caring for the patients in the Eastern region. So we highly appreciate for their input. We cannot forget the Lions Busia Greater, They have also been very closely with us in the mobilization, medical provision, and also they have identified friends from Texas who are willing to also support in the establishment of vision centers. As you heard from Dr. Mayeko, vision centers is a Benedictine Eye Hospital specialized branch which will be set up in Busia, the first of its kind, to ensure that we bring services closer to the community. And that's why, because as we are screening, we have discovered that our community have a lot of avoidable blindness like cataract. So all this we need to put this center nearby so that they can be able to identify these cases when they are still young before they exploit. So this is what we have been doing, and I highly appreciate the community, the Ugandan government. We are working closely with, because the Ugandan government has been able to second staff to our hospital to give us PHC, primary health care fund, also to support us in the supportive supervision in all the activities we do. So we also appreciate our colleagues here, the Benedictine staff. Without them.
Hello. Start. My name is Lion Kalungori, member of the Lions Club of Busia Greater. It's part of the Lions Club International, but under the District 411 PDC Uganda. Today we are having this activity of eye screening, and particularly we are doing it to the children. But we are not doing it alone. We are doing it in partnership with two other organizations. One, we have San Marcos Lions Club, which comes from the USA. Then St. Benedictine Eye Hospital from Toronto. We are really very grateful that we ourselves couldn't have done much, apart from the mobilization. But these two entities have really helped us to reach where we are. We are grateful that what we have done so far in terms of reaching out to the community, and particularly the fight against blindness and the sickness of the eyes, has been handled very well. It is our prayer that we have another opportunity to have this activity done in particular different places. Our interest is that it is reaching out to the community. Everybody is benefiting, and it is cost free. We have been doing it free, and this is quite humbling. The community has responded very well, especially when we are dealing with the children like this. And these are the people who follow when we have left. And this is one of our activities that we, as Lions, we have diabetes. But again, there is also diabetes which affects the eyes. So this is very well handled by Medical Hospital, and it is really helping us. We are also dealing in hunger activities. We are dealing in environment. We are dealing in sickle cell awareness and such causes. But we are humbled that this has been successful, and we are grateful to present here to Benedictine Eye Hospital Toronto with the team that has been quite cooperative. Thank you.
What's your observation?
My observation that there is need for more attention. The turn up today is a single day, but the need for attention is quite really. You can see there are so many people. We have heard about 800 or something like that, the whole school, and then we haven't even finished. Now, this is only a single school, but you can imagine how many other schools are near them. So what do we expect? We expect a very big turn-up if we made public, or if we went to different institutions. So our recommendation is that we look at other avenues of how we can have similar and other activities of this kind.
Thank you.
I'm Lion Bishop Moses Barasa. I'm from the Busia Greater Lions Club. I'm also the Son Chair of the Lions Club here in the region, that's called the Eastern region. We are here in this community to serve as Lions, as our core values of the Lions. You see that we serve the people who are needy. And this time I've decided to serve the children. As many of you know, the children need a lot of care and support, more so when it comes to the issue of sight. Because, you know, the sight is everything. These children you see here, many of them, when their sight has been affected, they cannot read books, they cannot do more than what they're expected to do. And in this community around the Busia areas where we have worked, we as the Lions Club, together with Benedict, these are areas which most of the people have been affected, the children. This time we have decided to see that how can we reach out the services to these children by eye screening, so that we can identify those ones who have problems, and then we see how can we help them fix that problem. So that's what we've been doing. Most of this place we want to thank, our appreciation goes back to St. Benedict for the great work they're doing together with us, the Lions, Busia Greater Lions Club, to see that together we can reach out these children in these communities so that we can screen their eyes, and not only screening the eyes, but we can also give our services. If you have those ones who have problems, they need medical care, they need surgery, we can give in a hand as a Busia Greater Lions Club so that we support. We are working out, we as a club, to see that we raise support, we go and raise some support so that we can really support those children who need surgery and those ones who may need more medical care. So this activity has been so great, and the need is too big. The need is too big. There are more places where we feel we need to go, but we are working more hard with GAN, with other partners, as the Busia Greater Lions Club, and also me being the zone chair, we are going to see that we expand this to most of our clubs in this region, to see that we also can work together to raise funds where they are, so that we can support the children. Well, as the Busia Greater Lions Club, first of all, we are going to do more of mobilization in schools and communities. We are going to continue strengthening our partnership with St. Benedict to see that they can come and help us with screening. And then two, we are also raising support. We are raising support through will wishers, the club members, to see that we can support those children who need the medical care, and also those who need surgery to be worked on. One of our more things that we address in Lions, more so is the issues of sight. And this is something which is very special. And those are things which we want. So what we are going to do as Lion Club, one, we are going to start raising funds through our networks, innovations, members, and some of our friends, to see that we can support those children who have been identified, who need the special care, and those ones who need surgeries and more medical support. That's what it was.
Yes, I'm John Paul Masika, a teacher in Tiira Primary School. I'm so grateful today that I'm here with the Benedictine Eye Hospital. I've performed a very important task to our children plus the community at large, because I've seen old men, old women, plus the people whom I brought being examined about their eye problems. And indeed, much that I had not known and discovered, I have discovered. At the beginning, I first brought only a few children whom I had identified as a person, as a teacher, that they may be having eye problems. But later on, when I was advised to bring the whole school, even children who were very normal, who thought they are normal, have been discovered they have problems and they have got relevant treatment. I've seen many of them happily going back home with good treatment. We thank this organization so much for the initiative which is helping our community. I think it should go beyond other boundaries that people may benefit. Being a teacher, this service has greatly helped because for us our work is to teach, but we may not know the problems that the children whom we are teaching have. For example, we find that other children, when we are teaching them, they have difficulties in seeing. So you write in a certain part of the chalkboard, the child is saying, "Teacher, I'm not seeing." You tell him, "Excellent, this way." The problem remains, "Teacher, I'm not seeing." So with the coming up of these services to them, I think it's going to help us so much that we may teach children who can be able to be taught and to see exactly what we are teaching on the chalkboard.
I'm too grateful. I know my community has got good service. They've been coming here with a lot of complaints, and for that I'm so grateful, and all the thanks and the honor, in fact, I give them back to God, because without God you couldn't be here. Everything is planned by God. We as human beings, we can plan to do everything, but if God doesn't have a hand in it, there's nothing that can move on. So for this activity to be there, it was by the grace of the Lord. And now I'm so grateful, and my request to the director is, at least I request for more camps here. Not all the people, the community have got the service. That's what I know, because the number I've seen, it is much, but still most of the people have remained behind. Some of them, is it due to the poor sensitization maybe, or some people don't have radios. That's why most of the people are not there, but the number has been high. So there's a good number that we've received here, to my knowledge and what I've seen. So I request, and those ones will go to the serious, those ones who are at risk, at least request you work on them. Those ones who need surgeries, you work on them. Treatment, those ones who are, some of them I know the treatments maybe which may not have. I request you come back next time, maybe with enough treatment. So some have been coming here asking for some treatment that what was not there. The situation I see, we should have a sensitization to the communities, and they be aware of the illness attacking the eyes. I think most of them don't attend at networks, because most times when you don't, especially the first trimester, that's when you get most complications, when the kid is born. So at natal attendance should be achieved, especially the first trimesters.
We have done this AI outreach the 3 sites of Awero East, Our Lady of Lords, the same between Lumino and Tiira. It has been impressive that we have had a big turn-up of the clients, both adults, children, and people from the community. We have really been impressed by the turn-up. What I can say is that the mobilization was good. Both in the community and in schools. And we have seen a number of people who have conditions, especially that come with old age, like cataract, glaucoma, and we have also seen many cases of presbyopia. Some of them come because of age, some of them are familial conditions. And also there is another unrecognized condition of allergic conjunctivitis, which is very, very common. I think a big number of people had allergic conjunctivitis, and this is a condition which can be managed. But we are also able to see children which have a good number of children with refractive errors that have been referred to the doctor in a hospital, where they need further evaluation and management. And they want to appeal to the doctor in our hospital and the Lions that we continue with this partnership, so that the children who have been screened and found to have eye conditions, they should be able to get adequate service so that their eyesight improves. My other appeal is that because of this big turnout, we know that in the three centers there are some people who heard about the commission, about the campaign. They were unable to come because of issues of transport. So we request that we organize for another outreach, at least like 3 various sub-counties, and we continue the organization so that other people who have been left out be able to come and then benefit from this service. Also during this outreach, they also need to add on the drugs so that people who come, they should be able to get the medicine. Because what normally motivates people to go to the facility, when they get their problems, and then they give them their medicine. And also at the facility, as a district, we request that they extend service to the nearby hospital, because we have a lot of people with conditions that need surgery, but access to the facility and the cost was a challenge. And in summary, I want to appreciate that time for extending the service to the community of Busia, and pray that